For the salient features of microscopic discectomy, it is considered a standard surgery for the lumbar disc herniation currently. Compared to the UB, it has a slightly larger incision. No water-based homeostasis is achieved. It has a slightly more tissue damage, and the magnification power is variable, which can reach up to 20x. Compared to unilateral bipolar endoscopic discectomy, it's a dynamic procedure where water-based homeostasis is achieved, thermal injury protection is there, and magnification is about 40x, and it is considered as the least invasive procedure. The aim of our study was to evaluate and compare the clinical outcomes with post-operative follow-up between unilateral, biportal endoscopic and microscopic discectomy techniques. The objectives are assess and compare the post-operative pain relief between patients undergoing UB and MD, utilizing the validated pain assessment skills such as VAS, ODI and SF36 score. Assess specific post-operative complications associated with each surgical approach. Materials and methods. Prospective study of 60 patients and with symptomatic lumbar disc herniation. 30 went under UB discectomy and 30 patients underwent microscopic discectomy. Patients were followed up for 6 months. These were the inclusion criteria where men and women above 18 years of age with symptomatic lumbar disc herniation. Conservative treatment was unsuccessful even after 4 weeks. Preoperative MRI scan reveals lumbar disc herniation and no previous history of any spine surgery. Primary outcomes were preoperative VAS score, ODI score and SF36 scores, and postoperative VAS score, ODI and SF36 scores were measured on postoperative day 1, 1 month, 3 month and 6 month follow-up. Secondary outcomes were length of hospital stay, duration of surgery, postoperative mobilization day. This is the demographic where 28 females and 32 males were there in the study. Mean age for male was 43 and for female was 45. Most common level involved was L4, L5 level. VAS leg score, we can see that the fall in the VAS score on the postoperative day 1 itself is significantly more in the UB group than the MD group, while on long-term follow-up there is no significant difference. For the ODI score, fall in the ODI score on the postoperative day 1 and at 1 month follow-up is significantly more in the UB group than the microscopic discectomy group, while the SF36 score is significantly more in the UB group than MD group only at the 6 month follow-up. Operative time in minutes was significantly longer for the UB group than the MD group, while hospital stay in days and post-op mobilization were slightly shorter hospital stay and early post-op mobilization in the UB group, however not statistically significant difference. In the discussion, both UB and the microscopic discectomy groups are the reliable techniques for treating symptomatic lumbar disc herniation. UB resulted in a more faster pain relief than the microscopic discectomy group in the early post-operative period. Equivalent clinical outcomes between both the groups are seen at 6 month follow-up. UB has a slightly shorter hospital stay and post-op mobilization status, however not statistically significant than the microscopic discectomy group. The operation time was significantly more in the UB group than the microscopic discectomy group. The limitations of the study was small sample size and a short-term follow-up. Other papers which are discussing about the two studies are that the compared MED and the UB group has the advantages of shorter hospital stay and good short-term curative effect, but no significant difference in the long-term efficacy and safety, while Feng study showed no significant difference in the efficacy between the two groups. Tang's research specifically made a meta-analysis of the post-operative complications. Results showed that there was no statistical difference in the total complications between the two groups. To summarize, my study showed that immediately in the post-operative period, the UB group demonstrated efficacy in lessening pain seen in the VAS score and the ODI score, while follow-up at 3 months and 6 months post-operative showed that there is no significant difference in the functional outcomes, indicating that UB group and the ME group have the same curative effect. Limitations warrant further prospective randomized studies with larger sample size and longer follow-up. Thank you, sir.